Hey everybody, I'm 2.5 weeks out from my hip FAI procedure and labrum repair. Basically, I've been having hip pain from 9 years ago, and I was doing like flares, flare 90. Over time, I just had this hip pain, and I got an MRI like in 2014. I was getting bad sciatica, but I managed it by just stretching and doing a bunch of hip workouts, abductor, abduction, the open closed leg machine, deadlifts, leg lifts, just strengthening everything. But, after 9 years of trying to keep my shoulder and my hip together, when I couldn't do physical therapy anymore, after I tore my ACL, I decided to just get everything done. So I had my post-op appointment a few days ago for my 2-week checkup, and basically there was a 3 o'clock to 11 o'clock labrum tear. That's basically 66% of my labrum was torn off. It explains a lot of like the shifting in my hip. I could never like stand up straight without pain, stand for long periods of time. I couldn't do squats without feeling like some shifting in my hip. And I kind of combated that with putting a band around my legs to make sure my glutes were engaged to keep my hip in the socket. But yeah, after the surgery, I felt immediate relief. I don't feel any shifting or clicking in the capsule. The recovery's been really smooth. I'm pretty happy I got the operation. I think the pain before surgery was worse than the pain right after surgery. And then for this operation, it was pretty simple. It was supposedly 2 weeks, weight bearing is tolerated. I had the labrum repair. I had the bone shaving for what caused the labrum tear in the first place. And that's FAI, which is just a condition where you can have like a bone, extra bone protruding. And if you do a lot of kicking movements like flares, it'll kind of keep grinding into the socket and tear the labrum. And so that's what happened on my left leg. They're expecting me to make a full recovery and be able to return to dance, so pretty excited about that. So we'll see how that goes. But basically for the first week, I was using 2 crutches. I weaned off to 1 crutch within 2 days. I could single leg squat on this leg before, and I was squatting 365, 1 rep max before I tore my ACL. So that was about a year ago. So my left leg was always pretty strong. So there was a pretty quick recovery. I went to physical therapy 2 days after the surgery, and I had this continuous passive motion machine. It was covered by my insurance, and I was already able to get to 90-degree flexion by 3 days. They recommend starting at 40 and then move up 10 degrees every day. And then regarding the recovery, at nighttime I would wear these like foam boots that like hook together, so my legs were stuck like this, and then it prevents your feet from rotating externally outwards and internally outwards or inwards. I don't know. That was 7 nights. Just took Ambien. I was recovering from like a mild case of bronchitis too, so that's probably why I was so tired and couldn't really record a video. Besides that, I had this hip brace on that limited hip flexion, and maybe the only other issue was it was hard to lift my leg. It's kind of similar to my ACL, where the ACL had your quad is deactivated, and you'd spend a few days trying to reactivate the quad. In this case, the hip flexor gets really tight and it's hard to activate, but that was pretty easy to raise the leg up. After 4 days, I didn't really have a problem getting into a car, and 2 weeks out, I'm able to walk. I'm not wearing the brace anymore. I'm not using crutches, and I can do pretty standard like leg raises. I'm doing like hip exercises at PT. So yeah, it's 2.5 weeks. It's about 4 to 6 months to return to sports. So we'll see how that goes. And then it's been 4.5 months since my shoulder. I'm getting full range of motion. I was able to do a forearm stand on both my forearms before I got the surgery on my hip. So that's recovering well. And then my right knee, I probably just need to work it out for maybe 3 more months, but it was feeling pretty good for footwork before my hip surgery, and I think I just need to do some more one leg squats to get this fully back to normal. But excited to see how that goes. And I'll record some more updates as I see how the hip recovers, and just see like when I'm able to start stretching, doing splits, working on like L-sits again, doing handstands. So kind of just trying to get my foundation back for breaking. And yeah, so if you're curious about the first week, it wasn't too bad. I think I just had to like lift the hip by the brace for the first few days, and eventually I got pretty comfortable. I think I walked too much, and I was hobbling around my apartment for the first week. My hip got really tight one of the days. I think I had like a snapping hip one of the days, but I haven't had an issue since then. And I will note that when I'm at physical therapy, I'm doing like bridges and stuff again, there's no more shifting in my hip. If I was doing glute bridges before the shoulder surgery and the hip surgery, like the shoulder would constantly like shift. So I had to really make sure I was aligned. That doesn't happen anymore. And then the hips are good now. And I started working out at like the 1 week mark. I was going to the gym again, and I've been going to the gym quite a bit. It didn't seem as debilitating as the shoulder surgery or the ACL recovery. I'd actually say the hip was super easy, and if I ever had any other issues, like if I have like a minor impingement on the right hip, if it ended up being in the labrum tear, I would probably get the surgery right away because it prevents cartilage damage, and the further when you get older, it'll reduce the need for a hip. It'll prolong your hip health, your hip joint, so you don't have to get a total hip replacement. So I kind of wish I got this done earlier, but the surgeon I went to, he does a lot of NFL players. He's a really good surgeon, so maybe it was good I waited because the technology and the surgery is kind of a more recent development. So modern medicine is pretty cool because 30 years ago, this procedure probably didn't exist, and you would have just had to suck up the pain and deal with it. But yeah, that's it. And just getting more comfortable walking and starting to do hip movements, and everything's good. Sleeping in the bed. I'm not sleeping in like sitting up like I was from the shoulder surgery. So pretty easy. And 4 months should be pretty quick. Granted, it's been a year now of recovery, so hopefully I'm no longer part of injury all-stars after all these surgeries. That's it. I'll give another update in a few weeks. I'm getting lazy with these videos. It's just been constant physical therapy and working out.